Okay, it is a couple of minutes past 1, so let's get started. And firstly, just to introduce myself, my name's Vicky Cockman. I'm the Director of Training and Consultancy at MHFA England, and my pronouns are she, her. Thank you all so much for joining us today. It's Mental Health Awareness Week, and the theme this year is community. And we know that being part of a safe, positive community can be really vital for our mental health and well-being. Today, we're going to talk about how a strong community of mental health first aiders can support the culture of your organisation and should be a key component of any mental health and wellbeing strategy. I've got a couple of housekeeping points that I'm just going to run through just to make your experience on this webinar a little bit easier. So just to make you aware, the webinar is going to be recorded and we will be sharing the presentation and recording with everybody that's signed up afterwards as well. Your camera and microphones will have been automatically switched off just to make the experience slightly smoother, but the Q&A function is live. So if you've got any questions throughout, or you'd like to ask our wonderful panel a question afterwards, that function should be available for you. We also really encourage you to use the chat function with other attendees as well, so you can talk to each other throughout. We also, if you require closed captions, you can select the show captions icon, which you should be able to see at the bottom of your screen. And if you want to stop those closed captions, you can just select the hide captions icon as well. You can also hide the chat comments. We understand that sometimes when conversation is happening and lots of people are in the chat, you can just right click on that and just remove the notifications if that is of benefit to you as well. So today I am so grateful to be joined by such a brilliant panel of people, and I'm really excited for this conversation who will be talking about how mental health first aiders can play a part of supporting mental health in workplaces, sharing some of their experience and the role that they play within their organisations. We're going to be discussing some of the steps needed to implement a really effective and impactful MHFAider network. We're going to look at the role of leadership and how you maintain that MHFAider visibility as workplaces are working both hybrid, remotely, or full-time in the office. So as I said, there'll be plenty of question and opportunity to ask questions to our panel at the end. So really encouraging you to use the Q&A function. I am going to hand over to our panel to introduce themselves. So we've got Matt, Sian and Mubs on the panel today. And as I said, I'm so excited to be having a conversation with all three. So I'm just going to ask each one to take 30 seconds to introduce yourself to everybody that's attending this webinar today. So Matt, if it's okay, I'm going to come to you first.
Thanks, Vicky. Hi, everyone. My name is Matt Wilson. I'm the UK Wellbeing Lead and Mental Health First Aider Lead at Computer Centre. My pronouns are he, him, and I've worked in workplace wellbeing now for around 7 years across multiple organisations and leading the mental health first aider networks for around 5 years now. So it's great to be here as a panellist this time, having attended many Mental Health First Aid England webinars over the years, which have been hugely helpful to me personally. So thank you very much for the invitation.
Thanks so much, Matt. Sian, if I can come to you next.
Yeah, hi there, Sian Bridden, pronouns she, her. I work for Nationwide Building Society as a Senior Manager for Colleague Experience. I've been a mental health first aider actively for about 5 years. I'm a mental health first aid instructor member, so in-house at Nationwide. We've got around 200 mental health first aiders, and I also founded our mental health employee network where we've got about 1,200 members. So lovely to meet you all and looking forward to this.
And Mubs, if I can come to you.
Hi all, Mubs Mahmed from First Bus, pronouns are he, him. I am currently a community and social value partner for First Bus North and West Yorkshire. I'm new into this role, and prior to this role as the Wellbeing and Employee Wellbeing and Engagement Advisor for First Bus North and West Yorkshire, and also the lead mental health first aider, supporting and looking after our mental health first aider network. I've been a mental health first aider myself for about 6 years now. I'm really looking forward to engaging and taking part in this webinar today.
Thank you so much, everyone. I'm really looking forward to starting the conversation. I'm just going to take everyone through a few kind of key stats around mental health first aiders, and then we've got a couple of polls because we're really keen to hear from the audience and those that have attended today. So you all have a bit of an opportunity to input into those polls as well. We know that mental health first aiders play a really crucial role in supporting mental health within their workplaces and beyond into their communities as well. We know that mental health first aiders promote early intervention and recovery, offer a space for non-judgmental listening. They're trained to be able to provide support during a crisis. They help to educate their peers and reduce mental health stigma across their workplaces and communities, are available to signpost to further support so people can seek the help that they need. And also they're contributing to normalising and creating a culture where everybody can speak openly about their mental health. Our most recent MHFAider survey showed us that 91% of people believe that mental health first aiders save lives through the conversations that they're having. And 94% of mental health first aiders believe they are challenging stigma around mental health in the workplaces that they're in. 83% of mental health first aiders say that they are there and help support the mental health of their workplace, with 91% reporting that MHFAiders are contributing to transforming the way that society talks and supports mental health more widely. As I said, they play such an important role in maintaining and supporting workplace mental health and well-being. And we know and advocate that this has to also be one part of a wider well-being solution. Mental health first aiders alone won't resolve things, and we always want to make sure that they are part of a much wider solution within a workplace as well. We also know that for mental health first aiders to do their role really effectively, they have to be fully supported and part of a network, and make sure that they have the resources and tools to be able to carry out and apply their knowledge and skills really well. And with that, I'm going to take us to our first poll. So we'd love everybody on this webinar a poll should pop up in a window on your screen. And we just want to ask the question of, do you have an MHFAider network? So if you're in a workplace or part of a community organisation or part of a community group and you've got mental health first aiders, do you have an MHFAider network currently set up? Brilliant. And we'll be looking at some of those results later. And the next question we're going to ask people to contribute to is we're going to ask everybody what is the one challenge your MHFAider network is facing. We're actually going to leave this poll question open for some time throughout the webinar, so you've got some opportunity to think and reflect about it as well. We've got our first poll results through, so we can see from those results that just over 50% of people have got an MHFAider network involved, and just under don't have. So we hopefully through the conversation today we'll be giving everybody the opportunity to hear some really good tips and tools to be able to take that away to their workplace in implementing a really effective network. So I am going to move us on to a discussion with our panel today, as I'm really keen to hear your experiences, Matt, Sian and Mubs, in terms of what's happening in your workplaces at the moment. So the first question I have for you is, what are the key elements in creating an MHFAider network? And Matt, I'm going to come to you first. We were talking the fact that you've had one of your MHFAider network sessions and meets this morning and before this webinar, and I'd love to hear what's happening in your organisation with kind of the creation of that.
Yeah, definitely, Vicky. Thank you. Our network has been, it's existed at Computer Centre for over 6 years now, actually. I've only joined Computer Centre in the last sort of 4 months or so, but having inherited a group of around 60 mental health first aiders, the key for me to start with was to connect with them, was to reach out to them to understand how engaged they were with the initiative, you know, whether there were any challenges that they felt were kind of barriers to them providing, you know, consistent mental health first aider support, and anything they needed from me in terms of, you know, from a leadership perspective, from a training and development perspective. Just gathering that information to start with was really important to understand kind of how the land lies before starting to do anything with the network. And then trying to encourage them to connect with each other in different ways. So setting up monthly calls. We've set up every fortnight we have MHFA check-ins with each other, which are informal meetings as well, so we can just come and support each other a little bit. And just understanding from them, how things have worked in the organisation, because I think each organisation has a different way of running that network themselves. So it's really important to understand that kind of organisational context before you go too deep into anything early doors. So yeah, that's what I've focused on to start with over these first few months.
Thanks, Matt. And Sian, what have you found are kind of the key elements in creating a really effective MHFA network, and how are things set up at Nationwide?
Yeah, so I think the piece that I'll probably cover off is the training side of things. So we're set up slightly differently because we've got 3 in-house Mental Health First Aid England instructor members, which we kind of do around our day jobs. So for us, it actually starts before someone becomes a mental health first aider. That's where the initial support starts. So aside from kind of providing clear, detailed, upfront information about the role, how it's going to work at Nationwide, the support that's available, recognised in their support channels at Nationwide, but also we've got the association, and we've got other sort of wellbeing partners. We kind of host a sort of an expectation session up front with an instructor, kind of to talk about the role, the boundaries, what to expect on the course. We make sure individuals have a meaningful conversation with their manager before they go in the training, because obviously manager support for mental health first aid is crucial. We also we kind of do a little bit of pre-learning as well. So Zero Suicide Alliance have a fantastic e-learning that's available online around suicide awareness. So we ask anyone who's interested in becoming a mental health first aider to take that training up front. And actually that's been really beneficial, because some people off the back of that have decided they don't want to proceed, which I think is just as important. And then we put everyone into training cohorts so they can start buddying up before they even go on the course. We'd run a welcome session. We double check on adjustments people might need. And then that's all before they even start the training. Then once they've been through that training, the ongoing support and development carries on. So we publicise anything that comes through from Mental Health First Aid England, from an ongoing training resources perspective as well, which is really important. And even now, it's also Learning Work Week as well as Mental Health Awareness Week. So we've got a campaign running at Nationwide to get our mental health first aiders a bit more aware around colleagues who are neurodivergent, and anything that we kind of run at Nationwide which is wellbeing related, whether it's perspective taking sessions or external speakers, we kind of really encourage our first aiders to get involved in those, so that there's this constant kind of upskilling of knowledge, etc. Just one more point on the training. So there is obviously through every 3 years an expectation that people refresh their knowledge. So at Nationwide, we've actually taken the decision that our individuals go through the full course again, as opposed to the refresher. And the feedback we've had from individuals off the back of that has been it's kind of like a rebuild of confidence again. So again, that's just something else that we've done, mainly focused on the training side of things at Nationwide.
Brilliant. Thank you so much for sharing, Sian. And Mubs, you shared that you've been an MHFAider for 6 years, and I would love to hear kind of your experience as an MHFAider and what it's been like to be part of a network, and what's happening at First Bus as well, or more widely.
I mean, very similar to Sian in terms of promoting and raising awareness of the support that's available. But before that, it's about ensuring that we're having meaningful conversations with individuals who are expressing an interest to become mental health first aiders, ensuring that, that the role definitions are clearly outlined, the role is available and open for them, and it's the right role for the individuals who are expressing the interest. But going prior to that, I think in an industry where majority of our colleagues are frontline staff, it was very important to us working with our senior leaders to ensure that we have a diverse range of mental health first aiders from diverse range of backgrounds, roles, and departments. And I think that was very good for us in our strategy to ensure that promoting awareness, helping start conversation, reducing stigma, and having the confidence to be able to open up and come for support. The peer-to-peer conversations for us was very powerful in getting people to open up to somebody who's within their team or somebody who's at the similar level to them in the company and the role. And that was a very effective approach for us in our industry and within First Bus. And that's where we started to gain traction on colleagues expressing an interest to become mental health first aiders. And it was twofold, actually. It was for them to help support, but at the same time, people were realizing and understanding this is an opportunity for me to learn about mental well-being, an area which has so many stigmas associated with it. So the interest was building because of that, and for the right reasons, and helped us build a really strong network, which I believe it's close to 200 mental health first aiders across the country at First Bus now.
Amazing. Thank you all so much for sharing. It's brilliant to hear such strong networks of MHFAiders and the impact that they're having. I think one of the themes throughout that, and one of the questions certainly that I know that we support on quite a lot, is at that initial stage. So almost the recruitment of your mental health first aiders. How, if we have an organisation on this webinar who was thinking, what is the best way to go about recruiting people into that MHFAider role, and what considerations would need to be taken? What would your kind of tips and advice be for those organisations that are looking at different ways to approach that recruitment? So I will open that out to anybody at the panel who would like to contribute to that. Would be wonderful.
I don't mind starting off. So how it works at Nationwide, we've got got a SharePoint page that talks around information about the role, support that's available. We cover off all the course content. We've actually also kind of got, it's not a performance management goal, but we have like a volunteer kind of goal that talks about the role and expectations. And we have an expression of interest form. So it's a really simple Microsoft form that an individual would complete to kind of express an interest, having kind of looked at the information that they've gone through. Obviously, speaking to a manager, we make sure managers are fully aware that they know what the individual is kind of going into, but also really important questions like, kind of what's going on in your life at the moment? Are you at the right time to be doing this? Because also we have quite a waiting list. So actually someone might sign up 4 months ago and actually time moves on, and the situation they might be in at the time of training, actually things could have changed. So we need to regularly check in with people who are kind of waiting to go on to one of our courses as well. But yeah, lots of upfront information. There's an opportunity to go and talk to other first aiders that have been doing the role to really understand kind of, this is a tough volunteering gig. So they need to understand the types of conversation that they might be getting into, but also really understanding the boundaries of role and the support that's available. So I think for me, the most important bit for me is that really the upfront kind of attraction and onboarding piece, really, to make sure that people are they're well informed. They've had plenty of opportunities to ask questions, and actually we have trained people and they've actually dropped out on day one because they've gone, you know what, this is not right for me, or they've done the full course and they've gone, you know what, personally this is really going to benefit me, but I don't actually think now, having done this, I am the right person for it. And that's absolutely fine as well. So I think we can do as much sort of checks and balances in advance to make sure it is the right person, that this is something that they want to do. But I think it's absolutely fine as well if during the process of the training course that people decide there and then that, they need to step out from it.
Absolutely. Matt, anything that you'd like to add to that?
I totally agree with Sean, and we adopt a similar approach in terms of having that upfront discussion, and again that two-way discussion about what the role is, what it entails, what kind of individuals we're looking for to become mental health first aiders, and importantly, asking the person who's expressing an interest is, what would you like to bring to the mental health first aider role? It's really important for them, because there have been conversations where I've asked that question, or my colleagues who are in charge of recruiting have asked that question, and we've had some fantastic responses that come out from outside of the box. I'm thinking, and especially some really good strategic approaches that people from the frontline colleagues would like to see in terms of the support that's available. From there on in, again, that conversation clearly defines the boundaries of the roles and responsibilities, ensuring, what it is that a mental health first aider is required to do and support with, the do's and don'ts of the conversation. And we have had many discussions with colleagues who have joined the program and then come to realize that it's not a role for them, and just like Sean has explained, have then dropped off. But at the same time, we've been able to have discussions around why they feel the role wasn't for them. Well, is there something that could be changed in terms of the training, or can we adopt a different approach? So getting some feedback of them has really helped us shape and outline some of the barriers that we faced early on in as an organisation.
Yeah, I completely agree with everything that Sean and Mubs have said. There's a few other things that we try and do at Computer Centre. One of them is to understand what part of the organisation the person works in. I tried to do a piece of work around profiling where our mental health first aiders sit within the organisation, so that we can ensure that we've got, a coverage of mental health first aiders where our people work. Because if we have all of our mental health first aiders sitting in one team, it's not really an inclusive support for everyone. So trying to find a kind of, a reasonable ratio of MHFAs to people is really, really important. Also ensuring that diverse piece, ensuring we've got, people from all different races, genders, backgrounds, lived experiences, anything that's going to encourage people to feel more comfortable in reaching out for that support is just really, really important to ensure that you've got that kind of breadth of knowledge and experience within your organisation, within your network, sorry. We also think about where those employees work, whether they work remotely, whether they work in the various offices that we have across the UK, and how often they're likely to be in that office, just to give us an understanding of, the kind of cross-section that we've got in the network, and how people can maybe share about, tips like how to be successful as a mental health first aider if you work 100% remotely, or if you're working in a warehouse environment or a factory environment, those types of things. Again, those questions that Sean and Mub said, really, really important that we ask people thought-provoking questions around why they want to be involved. One of the questions that I ask is, what would success as a mental health first aider look like to you? And I always get really interesting answers on that question, just to understand, if people kind of say, well, I'd really like to help to fix people, or to help them to get better, and I want to be part of that, then it's just helping us to understand those motivations, so that we can, make a judgment call early doors before we speak to them in person, to discuss their answers and get more context around them. But yeah, it's really a really important part of, gathering that information and really assessing the people that want to be a mental health first aider. We're actually hosting a introduction to mental health first aid webinar internally next Monday. And the goal of that session is to help people understand what mental health first aid is, what they can expect from a mental health first aid conversation, how they can get involved if they'd like to train up or find out more information about it, and obviously be there just to answer any questions that people have that might encourage them again to reach out for support. And it's just that constant encouragement throughout the organisation that the mental health first aiders, and we also have a network of wellbeing champions, that they're vocal about the fact that the mental health first aid network is there to support people, and how they can do that, how people can reach out, and all the different ways that the mental health first aiders should and will be making themselves visible to their colleagues. Just so important to raise that awareness.
And that, if I can just build on a point that Sean raised earlier on as well, is that conversation with the individuals who are applying with their line managers. It's really, really important, really crucial, because we then get an opportunity to get the line manager buy-in as well, from the different teams and departments across an organization, and importantly, the individual who's applying can start to have conversations with the line managers around the reasoning. They now want to become a mental health first aider, what ideas and opportunities they have to help raise awareness and support individuals from within the team or within a function. So it's a really important relationship and a really important point to consider when going through or starting the recruitment process for mental health first aiders.
Thanks, Matt. Absolutely, and I think organisations who are really doing this well is really understanding the connection of the role of the mental health first aider as not a separate role to kind of support. It's around how is it connected to people managers and into your wellbeing teams and into your HR support and more widely with your workforce, and that's a really, really important part of the support as well. We've had some questions. One of the themes that we've spoken about is around the importance of diversity within an MHFAider network. And somebody has asked a brilliant question around what is the best way to do this, and what if there are challenges in getting the representation of an MHFAider network to reflect what your workforce looks like. So any kind of advice or guidance on the best way to do this and make sure that your MHFAider network is diverse?
Yeah, sorry, Sean.
No, go
you go
for it.
first.
No, you did. I went first last time. You go.
Okay, thank you. I think one of the key ways that we engage with our colleagues across the board is through our employee resource groups. We call them employee impact groups, and those peer support networks. And that connection with the people who lead those groups, really, really important to sort of raise awareness of the fact that we really want to have an inclusive network. We want to be diverse. We want to have those variety of lived experiences, and including people who have neurodiversity. Just covering everybody as far wide and reaching as we can. So having those relationships with those people is really important. We also try and stay very close with our HR business partners and our sort of people advisory teams, and keep them in the loop of when we're going through kind of recruitment drives. Although it's a pretty constant thing, we're always looking to increase our numbers and increase engagement with the network. So that's the kind of first point of port of call that we always rely on heavily here.
Yeah, I totally agree. And it was actually a challenge that we faced early on, especially in North and West Yorkshire, First Bus North and West Yorkshire, where I am based. And along with communicating the value of mental health first aid, it's really important that we clearly communicate the value that mental health first aiders bring, individual mental health first aiders bring to the network. Was really important for us, highlighting the requirement for diverse recruitment in the mental health first aider network. What we also found very beneficial was the key to storytelling. So a mental health first aider, and just basically doing a day in the life of a mental health first aider, storytelling and talking about their experiences and how they've been able to support individuals, but at the same time what they've been able to learn, how they've been able to develop their own skills and their support network. And one of the key things I talked about early on in mental health first aider, as being a mental health first aider, is what I learned that I could take away from outside of the workplace back into my personal life, into my family life, and how I can support. So they see the value that it's creating for you as an individual, how it's, that continuous learning that you're having, how it's helping the individuals develop as well. And then we started working and having discussions through our employee, so we call them inclusion networks, which are in essence employee research groups, and engaging underrepresented underrepresented groups, actively engaging them and asking them for support and the reason that we need them, in order to create that safe, inclusive environment. We are needing support from underrepresented groups as well, and having them open, frank conversations. They're not always easy conversations, but you've got to engage in some difficult conversations and you will start to see the results come through, and you will start to see people seeing the value of the mental health first aid network and then expressing an interest and putting themselves forward.
I was going to say, it's been said for me exactly the same thing. We've engaged our employee network groups. Many of the co-chairs of the employee network groups are trained mental health first aiders. A lot of our mental health first aiders are allies of employee network groups. So again, they kind of spread the word. But yeah, we're not afraid to kind of like absolutely go forward. And if we need more men or we need more ethnically diverse colleagues, we will absolutely, shout that from the rooftops. And if we train a particularly diverse cohort, we will call that out as well, that, this is what we're aspiring to. So yeah, exactly what Matt and Mubs have said, really.
Brilliant, thank you. And I think some of this links into, we have spoken about the importance of leadership buy-in, and one of the key questions, I guess, to ask is around what role do leaders play in creating a thriving MHFAider network in terms of the championing it and endorsing it. And we also know that if you are a leader of an organisation, you want to know that you've got good return on investments, that it's actually making a difference to not only the well-being and mental health of your people, but the productivity and performance of your business as well. So I guess over to Pam and Sean, I'm going to come to you first, if that's okay.
Yeah.
What role do you think leaders play in creating a thriving MHFAider network, and what experience have you had kind of engaging senior leaders at Nationwide?
So we've been really lucky, and I say definitely in the last year in particular. So we've got 2 sponsors of our mental health employee network group, but also within that are the mental health first aiders. So with our 2 sponsors, one of them is actually on the executive committee for Nationwide. Fantastic, male, ethnically diverse. Really, this was a bit of a departure for him in terms of kind of picking up an employee network group around mental health. So it was fantastic that he kind of came on board with us. But his advocacy has been really instrumental in raising the profile of the network and what the mental health first aiders do. So we had the opportunity last year to go and meet our CEO and the rest of the executive committee to go and talk specifically about mental health first aid, what it is, what it isn't, the number of colleagues that are coming through, the key themes that are coming through, and they were really, really engaged. And the fantastic thing was, by giving us a bit of space to talk about it, it then kind of laid the foundation for our HR team then to come in and do a pitch for a digital wellbeing platform that we wanted. So actually that partnership then resulted in kind of that proposition then coming in. The lovely thing after then having that discussion with the executive committee was that we were then invited a few months later to meet the board of directors, and again explain to them around specifically mental health first aid and kind of tell the story and the journey that we've been on, and also the impact we were having. And it was a really gritty conversation because they wanted to know the kind of the breadth of the topics that come through and what are the topics that could trigger some of that. And it almost just feels that door has been opened. And, if I needed some resourcing or some funding or more awareness raised around mental health in the workplace, I feel that either of those groups I could go to and kind of, put that ask forward. It feels like it's absolutely part and parcel of everything we do now. And I think it absolutely underpins all decision making that we make across Nationwide, not just for our colleagues, but also from our customer perspective as well and their well-being. So yeah, leaders are absolutely crucial. We talk a lot about our kind of executive and senior, but I think our, the people managers who are actually managing our mental health first aiders are equally important. Some of our mental health first aiders have really difficult conversations, and knowing that they've got a supportive manager who might say, take a little bit of time out, or if you need to kind of reground and you want to contact our employee assistance program or reach out to a peer mental health first aider or one of our instructors, just to kind of maybe have a sounding board or talk about within confidentiality, a difficult conversation you might have had, that is equally as important. So it's kind of like leaders at all levels really, I think, have got a part to play.
Totally agree with Sean. We have the same. We have our, lucky enough to have our executives, exec board, and also senior leadership team members across First Bus who are sponsors of our inclusion networks, including the Wellbeing Network. And they actually play a crucial role in helping raise awareness, helping raise the support, because they bring a really good mix of, a strategic approach, as well as helping that promotion from a senior leadership team or from the exec board. And yeah, it's absolutely crucial that we have the senior leaders buy-in. But in terms of creating the thriving network from senior leadership team, it helps deliver the message that this is the right thing to do, and this is creating a safe environment, and it helps foster a culture where people are open to accessing support, because now you have an organization where it's not only the staff managers and it's not only people on the front line talking about well-being support and mental health or opening about challenges. You've got your execs and your senior leadership team members who are helping foster that culture as well. So it's really, really important.
Thanks, Matt. Matt, anything that you want to add to that?
Yeah, some great points raised there. In terms of adding to it, I would say senior sponsors for me in previous organisations have really been the role models for healthy behaviours at a leadership level. And I think we all know that, leaders need to demonstrate the behaviours that we want to see across an organisation if they're really going to, start that journey towards creating a culture of safety and as Mubs mentioned, that safe space where people can talk and open up and reach out for support. I also think they've got a real place in an approach around listening. The mental health first aider role is a listening role first and foremost, and actually having leaders who listen can be a really powerful tool outside of mental health first aid. And if you've got that culture where that your mental health first aiders are well versed in listening, then you're much more likely to get people coming forward and being open about other things in your organisation, which creates a much more positive culture holistically outside of the initiative. And I think the leaders that I've had who've been involved in mental health first aid have been visible, they've been vocal, and that does the complete opposite of having invisible leaders who can create uncertainty in organizations. They can create that kind of them and us feel about the leadership team and everybody else working for them rather than with them, all those types of things. And my senior leader sponsor had big input into my overall well-being strategy in a previous organisation. They helped me to learn how to build a proper strategy around both wellbeing and mental health first aid, understanding what your goals are, how you're going to achieve them, all of the pieces that fit into that jigsaw around the sort of bigger picture of mental health and wellbeing. So I've learned an awful lot from them personally, but I think there's so many benefits of having people in those positions, and not to mention access to funding. Let's not fail to mention the elephant in the room. Money is tight, and we, even just accessing a few £100s to train up a mental health first aider isn't easy for a lot of organisations. So, the more help you can get on that front, the better.
Thanks, Matt. I think there's, Sean, you mentioned it in terms of the recruitment of mental health first aiders and people sometimes doing the course and not necessarily wanting to carry on with the role. And Matt, you just mentioned it there in terms of actually some of the skills that you gain. I mean, the benefits of almost the core competencies that people want from their managers and their workforce around higher empathy, coming from a place of better understanding and creating a culture where we can speak openly, not just about mental health, but supporting the organisation more widely to perform and move forward. There are lots of benefits for it. And Matt, you're right that elephant in the room, but there has to be a conversation around funding for training, learning and development, and with things, I guess, happening around on a global scale. But lots of organisations are feeling that pressure at the moment. So it's really important that the return on investment is seen by, I think, not only leaders actually, but everybody in the organisation, so they can see that not only is their mental health and well-being going to be supported really well, but actually it's the investment is right for them. We've spoken a little bit around, I guess, making sure that MHFAider networks are engaged and supported and visible within an organisation. And I think there's lots of conversation, still lots of conversation about flexible working, and every organisation works slightly differently. Some people are at home, some people are in the office, and some people are hybrid. I would love to hear your thoughts, and Mubs, I'm going to come to you first, if that's okay, around how do we make our MHFAider networks really visible in the workplace so we can make sure that they're really impactful and doing their role really well.
Yeah, and I think in order to make the MHFA network visible, effective, and a network that's been utilised for support by colleagues, I think it's really important that organisations start to normalise conversations around mental well-being first and foremost, and create an environment where people are openly being able to talk about mental well-being, whether it's the good things or the struggles or where to go out for support. And one of the things that we learned on our journey to creating a mental health first aider network was raising awareness around mental well-being was really important. So I started to, just on a weekly basis, just doing a simple mental well-being newsletter where we talk about, what mental well-being is and the top tip for the week. So it was just, your challenge for the week. This week, try to take some time into the outdoors. Going outdoors helps with, creating a safer mind space, etc. And from there on in, we started to really highlight who the mental health first aiders were within each team and department, advertising their roles. Each mental health first aider did a little pen profile, why it was important to them, why they became mental health first aider, and how they hope to support everyone. So it's now starting to create that personal connections. They're learning a little bit about mental health first aiders, having a pen profile displayed on the intranet or just on a notice board in the staff notice area or in the canteen. And we started to see mental health first aiders being utilised, and we had to start thinking of approaches now that mental health first aiders are accessible. So within a team, we'd allocate some release time, because obviously mental health first aider was a voluntary role on top of their substantial role. So we had to ensure that we're now making mental health first aiders available for when the support is required, or available to raise awareness and have discussions. So we started to allocate some release time from their substantial role on a weekly basis for them to be able to go sit in the canteen or go sit with the workforce in a different team or a different department or a different office within our depot structure and start having conversations. And this really helped us drive, being a new model, and this really helped us drive the positive impact and positive conversations. It made our mental health first aiders more visible. It helped them create that personal connection with our employees. And then from there on in, we started to organize, virtual drop-in sessions. So now, we still are an organization as well. And besides our front office colleagues, we have a lot of our people who still work hybrid or work from home. How do we make it visible and accessible for them? So, simple things just as, on an evening, 5 to 6 o'clock, our mental health first aider network would join a Zoom session for a virtual coffee and a brew and come and talk about all things well-being and mental health. And that really helps drive that conversation and create that network which is visible and a network where it's now created that personal connection and it's accessible for colleagues to use. But importantly, the comfort level. It's about ensuring that colleagues are comfortable and employees are comfortable accessing support as well.
Thanks, Matt. Matt, do you have anything to add to that?
Obviously, Mubs, your organisation is pretty different to Computer Centre, and our focus is really on ensuring that we've got a kind of approach that works for in-person, for hybrid, for remote workers. And visibility really is key for that. So I talk a lot about proactive mental health first aid. That's anyone who's worked with me on the Mental Health First Aid Network will have heard me say that several times. But, you know, speaking about mental health first aid and wellbeing in your team meetings, using technology, using team statuses, and, you know, teams' backgrounds during meetings, just to promote the initiative and provoke a conversation, or provoke somebody to just think, oh, you know, what's mental health first aid about? It can just sow the seed for those kind of later conversations. Using our email signatures, you know, the MHFA logos, the Association of Mental Health First Aiders as well, if you're a member of that, wearing our green lanyards, really important. And, you know, just reiterating that point around normalizing those mental health conversations by role modeling openness and honesty and vulnerability in our everyday conversations. You know, sometimes we won't be in a place to do that, and that's fine as well. So again, just acknowledging where you are in terms of how full is your cup, how ready am I to be open and vulnerable, because sometimes that's not necessarily the right approach for you as an individual. So just being self-aware in that sense is really important. But, you know, just having those, you know, promoting and role modeling those healthy behaviours, those you know, slightly deeper conversations, but also simple things like taking breaks and setting boundaries around, you know, how you do support people, making sure people know, you know, that support is available and when that support's available, but you know, not making promises, not saying you're always available, just understanding the kind of finer details behind how you do make yourself visible, I think is really important. Yeah.
Thanks, Matt. And Sean, in terms of, I guess, the setup at Nationwide, you've got almost your HQ, you've got branches on a high street. You're a kind of a multifaceted business in a way. How does that work for you as well, in terms of making sure there's visibility across the whole organisation?
Yeah, so kind of everything that Mubs and Matt have kind of said, we've kind of got, but we infiltrate policies. So we're currently trying to infiltrate it sounds really sinister, doesn't it, infiltrate, but health and safety, e-learning, which is an annual mandatory requirement. Why shouldn't mental health first aiders be referenced in there? Communications. So we've done a massive campaign around Mental Health Awareness Week, Learning at Work Week. There was so again, referencing mental health first aiders. Any big changes within the organisation were referenced. Even in the last week or so, we've done an updated support to our colleagues, because we recognise, for example, there's been Supreme Court ruling, there's been tensions in India, Pakistan. So again, we always, without going into the details, we remind people of support that's available. So the mental health first aiders are in there. Any opportunity really to kind of raise awareness. We have a simple SharePoint page which lists all of our first aiders, but in particular we ring fence those in retail. So we recognise that those who are kind of maybe in one of our admin centres have maybe more flexibility to reach out to a mental health first aider or to be signposted to things like an employee assistance program. Whereas if you're customer facing in a branch, or you're an agent in a contact centre, it's more difficult. So what we've actually been doing is kind of having more leader mental health first aiders who are in those areas, and they're almost like ring fenced for contact centres, branches, etc. Who understand how those areas work, and they're a bit more visible and on the floor. Otherwise, the rest of our pool of mental health first aiders are basically available to absolutely anyone. And we actually find that works really, really well, because, again, from a trust point of view, quite often people actually want to talk to someone outside of their immediate area, to kind of maybe talk about a situation that they're in or some support that they would need. So lots of ways we kind of infiltrate, and really kind of like think outside the box a little bit in terms of how we can raise our visibility, in addition to things like email signatures, lanyards, and all of that great stuff that we've also got.
Thank you so much for sharing your thoughts on that. And I think there's lots of different ways that you can make your MHFAider network visible. But you're right, I think it starts right from the recruitment and engagement of that before you even go through the training, and then it's about momentum and the support afterwards as well. It's been so wonderful to hear all of your experiences of what's happening within your organisations. And we've had so many questions from the audience today. I'm going to pull out a few, and we will make sure that we follow up afterwards for anybody that has asked a question and we haven't had time to answer, if that's okay. So one of the first questions I'm going to ask, where there's a few people that have raised this, is around the number of MHFAiders within your organisations, and how do you go about that decision making to know whether you've got the right number of MHFAiders within your organisation, and whether you work to a specific ratio at all. So I'm going to open that up to the full panel to answer.
So I can go first. So nationwide, we've got 18,000 colleagues, kind of widely spread across the UK. So at the moment, given that, we are trying to go for sort of 1 to 100 colleagues. Ideally, we'll improve that ratio, but we have to be realistic around what the capacity of our in-house mental health first aid instructors, the support network that's in place. But we actively monitor volumes coming through. So we don't capture every single colleague interaction, but we get, because obviously some people will jump straight off a first aid call and into the day job. But so for example, last year we had well over 300, which again kind of helped inform us in terms of ongoing training. Already we're looking to increase our numbers because it is 13th of May and we've had nearly 150 interactions this year to date already, which for us we see as successful because the message, the visibility is getting there and more people are coming forward. But again, some of that MI that we capture definitely drives our thoughts around the number of mental health first aiders we need. But also, in addition to mental health first aiders, we're now delivering the mental health aware course, which we're prioritising for leaders and managers. So we're doing a pilot on that at the moment because we think a mix of the two for nationwide could actually work really well for us. So no specific target, but initially we were kind of going for that 1 to 100 colleagues, if that helps.
Yeah, just to add on that, I don't necessarily believe there's a right number in terms of a ratio. I would much rather personally have a fully engaged and connected mental health first aider network of 50 rather than a network of 400 who were disengaged and disconnected and not led properly. So I think you just got to be careful with regards to your resources and your ability to lead that group safely and effectively. That's kind of my piece of advice. And I'm always very willing to let people drop out if they're not feeling engaged or they don't have the capacity. I think that's really important to stress as well.
Yeah, absolutely, Matt, and couldn't agree more. It's the MHFAider role has to be focused as making sure it's effective, and it is around the quality and making sure people have the time, they feel supported, they feel that they can do their job alongside that role as well, rather than just having too many MHFAiders for the sake of it. It's about kind of making that impact and making sustainable change within an organisation rather than just having too many. So completely agree with that. There's a couple of questions as well around organisations that might have MHFAider networks set up, but where they are disengaged or where they are finding it hard to engage people into the role where they may have trained some time ago. Do you have any tips or advice or guidance around what you would share to an organisation about what they could do to kind of re-engage and re-communicate and make their MHFAider network really visible?
Yeah, I've got sort of gone through this process a couple of times in the last couple of years actually. So yeah, as I said earlier on in the piece, it's about reaching out to those people, understanding whether they're engaged in the first switch, whether they are active as a mental health first aider or whether they feel as though they're reactive. What support they need, what do they feel they're lacking that they would like to see that would enable them to become engaged again? Is it a case of getting more training? I love Sian's idea about getting everybody on the 2-day course every 3 years. I really like that. And I'll be thinking a bit about that because I think it's just a great way to reconnect with the wider group again for a sustained period where you're just focused on mental health first aid. There's no necessarily thinking about work during those processes, but just having that opportunity for people to come together and to speak openly as a group, I think is just so important. And ultimately the proof's in whether people are turning up to meetings, whether they're getting involved in your initiatives, whether they're voicing their opinions and giving feedback through whatever communication channel you decide. I think it's quite obvious to me, having been here for 3.5 months, who the people who are engaged are. Even if people have said that they are engaged, I'm not necessarily convinced yet, because I haven't seen anything of them that shows me that. You can say one thing, but it's your actions that really speak louder. So yeah. It's a tricky one.
Absolutely, and for us it was really important because we saw that as well. We saw parts of the MHFA network are being disengaged, and it was just being able to have an open, honest, transparent conversation with them and find out the reasons why they felt disengaged. Was it because they felt the role is not what they thought it was going to be, and they feel that they made a mistake, and giving them an opportunity to say, would you like to step down? Or is it because there's something missing from our side? Is there a strategic approach or anything that's missing from our side? And them conversations, some really insightful feedback that we had early on, and ensuring that we now, to keep the MHFA network engaged is providing that ongoing support. One of the key things to remember is, we encourage the mental health first aiders to reflect on their own well-being as well and provide support for them. Sometimes it could be easily forgotten that this network of individuals who are supporting the wider workforce, they require support as well. So that was really important for us. It was important to have, so we have regular meetings with our mental health first aider network. And to keep them really engaged, we invite guest speakers to come in from different organizations around mental well-being, and having that keynote speeches, etc., guest speakers, having a Q&A session such as this webinar with our mental health first aiders really keeps them engaged and really helps them, with that continuous learning to keep them interested as well, take new things away. And some of the other things was, helping the mental health first aiders to help you start creating case studies and stuff that we can put out to the wider organization and people, and have them case studies, as, this is the reason, this is why mental health first aider network is working, highlighting their successes, celebrating the network is really important, and that could be through award ceremonies that you would have, or employee award ceremonies. Have something in there, an element in there where you're celebrating your mental health first aider network as well, and that was really important for us.
Amazing. Thank you so much. What a wonderful point to end on, that MHFAiders are doing brilliant work. They are having such important conversations and absolutely should be celebrated and supported correctly within the workplace and beyond. It is 1 minute to 2, and as much as I would love to spend another hour answering the many questions that have come in, I am going to close up. Firstly, a massive thank you, Matt, Sian and Mubs. It has been wonderful to have a conversation with you and to hear what's happening in your organisations, and for the brilliant kind of expertise, advice and guidance that you've been sharing today. And mental health first aid, it doesn't stop at a single course. We know that mental health first aiders need the right wraparound support. We need organisations to be looking at this holistically and connecting it to their people managers, to their leaders, to their policies, to their wider strategy to have the best impact possible. If you have mental health first aiders, really encourage you to join the Association of Mental Health First Aiders. It is a dedicated community for those that have gone through the training, and they have 3 years support and tools and resources and additional learning that will help them in their role as well. So hopefully together we can transform workplace wellbeing for the better. Thank you so much. We will follow up with any questions that you have, and we will make sure we come back with some of those responses. But wishing everybody a really wonderful rest of day, a really, really good mental health awareness week. Take care of yourselves, and we will see you very soon. Thank you so much.